I'm going to be doing IV. I'm going to put a new bag, I'm going to hang new tubing, and I'm going to do an IV piggyback. First thing I'm going to do is I'm going to check my MAR. This is for John Jones. He is getting 0.9% sodium chloride saline as well as ampicillin at this time. So I'm going to come over, check my bag. I'm going to swish it back and forth, make sure there's no holes. I don't see any sediment. I don't see anything in there that shouldn't be. Do the same thing with the medication. Bring the medication over, check the ampicillin. 1 gram, administered over 15 minutes at 1800. It is 1800, so it's time to give this and do that. So now I'm going to set up my tubing. I would be in the med room prepping all of this. We'll just pretend this is the med room. So I take my tubing, untangle everything.
So she might say, like, you need 10 units of NPH and
Take my bag,
7 of
because these have been used before. I'm going to, which it wouldn't be in a clinic, but I'm going to spike it upside down so that I don't spray water everywhere.
the NPH, and then you're
Put
gonna
that in there.
the NPH,
I'm going to make sure that the end is clamped
and then put it in,
until I'm ready
and then you're gonna drop what you need for the
for
regular,
it to flow through.
push it in, and then
I'm going to hang this up.
draw that out,
I'm going to fill the chamber halfway.
and then you're gonna come over here and draw the rest up here.
There we go. There's a little line you can try and reach. There we go. And so now I'll let the fluid flow in.
For the 7 units.
I want this to be full of water or full of saline before I attach it to the patient. I don't want to have any air getting in to the patient. So yeah, looking good. Okay, so that's hung. Now I'm going to come over and I'm going to check the site of the IV. It looks good. It's not red. It's not swollen. It's not hot. I don't see any streaks or anything. Patient's not complaining of any pain, so we are looking good. I'm going to check the MAR versus the name, John Jones. John Jones. Again, going to check the med, make sure that it's the right med. At this time, 1800, ampicillin, 1 gram over 15 minutes. So now I'm going to go over here, get my piggyback tubing.
So here's the insulin. I'm gonna draw, give me a number, Nancy.
And this one there,
7 of the regular, and then 38
I'm going to hang the saline lower so that the piggyback goes in first into the patient. Oh, actually, I'm going to do the same thing here. I'm going to take this off. I'm going to take the, again, this is a bag that would not be open already. I'm going to clamp this, make sure that we don't lose any medicine. Put that there. Now this one is already primed a little bit. So with this, I would open this up and let the medicine flow in. Perfect. Okay. So now I'm going to come over here and I'm going to change the tubing on my patient. I'm going to undo the Luer lock. I'm going to pull this first. Make sure we're capped off. There we go. Pull this, okay, and we're going to get rid of that one. And I'm going to take this one, try not to
That's the only way I can do it. Because I'm worried about getting this.
attach this. Before we do that, we're going to alcohol,
You can always,
just to keep things
when you
clean.
have that, you can see where the sites are.
Okay. this cap off. My hands are wet. Seriously. Okay.
19.
There we go. Okay. So now I'm going to bring this over here and attach this.
And one thing, if you
I would also assess the skin where the tape is. If there was any redness or anything, I might consider switching to a different kind of tape. Would also make sure that all of these little piggyback ports are upside down to make sure they're filled with water. Don't want any air in there either. Okay. That's good. That's good. Open that one. Okay. And we are flowing, which is good. Now we're going to do the piggyback. Attach it to the top port. This is not flowing. I still have it capped off. We'll bring this one over. Clean this.
and then what else do you do?
Take that cap off. Squeeze that in. Bring the lure lock down. Tighten it. And now I'm going to open my port.
So when I'm preparing medication, when I get it out of the drawer, and then when I
Let this start flowing. This would start flowing. This one would stop, which it has, and we would be medicating Mr. Jones for an hour.